the News Channel 5 network. This is OpenLine.
Good evening, everyone, and welcome to OpenLine. I'm Carrie Sharp. We have a really good conversation that I hope that you will want to be a part of tonight here on OpenLine. We'll get that number here on the bottom screen in just a minute. But let me introduce you to our guests first. We have Dr. Katie Foss, who is a professor of journalism, gotta love that, and strategic media at MTSU. Thank you for being here. You have a new book out, which I'll get to in just a second, but first let's talk about your job. What do you do on a day in, day out basis?
Sure, I'm a professor at MTSU, as you just said, so my job is a lot of different things. It's part teaching, of course, interacting with students in the classroom, serving on a lot of committees, which no one really wants to hear about, and then I also do quite a bit of research and public outreach with my scholarship. So I really like to write things that everybody can kind of digest and understand, rather than just kind of keeping it in the academy.
You really have had your finger on this pandemic lately. You wrote a book that just is coming out about past epidemics and media and how we have perceived them through journalism. Tell me more about it. First of all, what is it called?
Sure, it's called Constructing the Outbreak, Epidemics in Media and Collective Memory, and it came out in fall 2020 of all the timing. And what I did in that book is I looked at a series of different epidemics through time, covering over 200 years of history, stretching back all the way to 1721 and smallpox. And I really examined the interplay between media of the moment, of the different platforms that were available at that time, and the particular epidemic, as well as looking at pop culture depictions that look back on each moment. For example, Twilight and influenza, which is a heavily distorted representation.
That's so interesting. Where did you get this idea to do this? Because we have to remember, you started researching and writing this well before COVID-19 happened. So why were you interested in this?
I've always been interested in representations of disease. I wrote my dissertation in my first book on medical dramas like Grey's Anatomy and ER. But this particular topic really came to me when I read a youth fiction book called Fever, 1793 by Laurie Halse Anderson. And I was reading it because my daughter read it and she was really excited. And so I read this, and it's all about this tremendous story about this fictional character, this young girl who goes through the epidemic in Philadelphia of yellow fever and her experiences. But what fascinated me about this one, and that was really different than other types of those books, was the incorporation of all these primary documents. So not only do you get her story, but you really do get the history of the moment. And with that, it was just like and I just had an epiphany that if she's writing this with these documents, they've got to be out there. And why haven't we told the story of how the newspapers covered that moment, especially in contrast to other evidence from that time? And that just got the ball rolling on this whole idea for the concept for the book.
So I don't want to delve into COVID yet, because that was before this book. But as you wrote this book, and as you know, you're set to publish, what did you take away from how we have progressed along the way of epidemics and how media interacts with that?
Well, first of all, there are patterns across time and I would say things that continue to our current moment. The cycle or kind of how the messages are delivered, for example. So there's always been a delay for different outbreaks, epidemics, and pandemics between initial cases and then the actual media coverage, or of course it'd be newspaper coverage and pamphlet coverage if we're talking about the 18th century. There's a delay, and there's also a kind of a pause before things really escalate in the newspaper coverage, and it doesn't necessarily follow the escalation of cases. And also, things tend to turn more positive and better before the epidemic has subsided. The light at the end of the tunnel, for what I call it, before that we actually see the cases go down. But I will note the biggest difference between these past epidemics and this latest pandemic, of course, is that back then everything was so local. So, and there are epidemics going on all the time because there are so many different diseases that have now been, that you can curb because of vaccines and improved public health overall and sanitation and everything. And so with these localized epidemics, you don't stay in that epidemic moment nearly as long. So it's more like 6 weeks to a couple months that would be in that really that crisis mode before, again, the coverage returns to a more normal state with like ads for what the ships are bringing in and local events going going on, and coffee houses reopening, and those other indications that things are, returning to as they were before the epidemic.
When you speak of some of those patterns, I start thinking of some of the stories that we did early on with COVID. I say, oh, I see that pattern, like the delay in reporting. There were these kind of glimmers of what was happening in Wuhan. It was like, oh, that seems so far away, and it's not a big deal.
Yes.
And then there was the one case, I think, in Seattle at a nursing home. People were like, is this a big deal or not? No, it's not a big deal. And then it was about a week, if I remember correctly. It seems like a lifetime ago almost.
It does.
And then things start picking up.
Right.
But when things really started, blossoming big time, it was like we were already behind. Really, what was happening.
Yes.
Is that? Do you see that? Did you see that?
I would say that in some ways we were behind and yet ahead.
Okay.
Because one of the reasons that we became so COVID fatigued was that this not only our 24-hour news cycle, but also our ability to communicate across such great distances meant that we knew things were coming for a long time, and thus allowing us to be more prepared. But at the same time, it didn't feel like the threat, or at least I would say in general, if we look at the discourse of the time, it didn't feel like the same kind of threat as walking out to an abandoned street because somebody had just died of the disease, or a number of people had died of the disease, and because you were already in the height of the crisis.
Yeah.
It does feel like a lifetime ago.
It really does. Sometimes I think, I can't believe that was just March of 2020, when really everything shut down right after the tornadoes here.
So quickly.
Kids were sent home, and you think of like all that we went through, and at the time we had no idea. Like, I remember telling a neighbor, it's probably just going to be 2 weeks. It's like the seasonal flu outbreak. And I think he probably laughs about that now.
Right. I had no idea, and I had just spent the previous 3 years studying epidemics. But I also think that we couldn't have prepared ourselves to be in it for so long, because how do you do that? Even the mental preparation that would take, and that is a deviation from the past. That in the past, people didn't see it as 2 years running, even though we know that influenza of 1918, 1919 did last a long time, because media coverage at that moment was also so localized, it didn't feel like it in the same way.
I have to talk to you or ask you about when you say media coverage from, the Spanish flu and on back.
Right.
Now it seems media is so big. It can include just everything under the gamut. Of course, there are journalists, and there are newspaper reporters, and there are television reporters, but there's also bloggers and podcasters, and all these kinds of different media we see. Social media is in on the game. Back then, I would think that journalism had a different place. But what other kind of media was prevalent in these other epidemics?
So if we're talking about actually all the way through 1918, 1919, of course we had newspapers. If we're talking 18th century, pamphlets were bigger, in which cheaply bound books that anybody who had the means to do it could reproduce these works, which is wonderful because it allowed the capturing of some voices that definitely were not part of newspaper coverage. And then if we move forward from that, magazines, of course, in the 19th century, and then books this whole time, but books look back on things. They aren't really produced in the moment in the same way. And then 1918, we still didn't have radio at that time, because that was before commercial radio. It was before people were making films, but they're not making films really to capture influenza. So really, things don't change as much until we have commercial radio. So the first epidemic with that I study, there's always, continuous epidemics, always, especially back then, was really 1925 in diphtheria. But because I focus on Nome, Alaska, you might have heard the story of Balto or the story of Togo, the sled dogs that brought the antiserum. That's what it's known for. Because I focus on a remote village in Alaska, even from then we don't have radio transcripts or anything. So it was still primarily newspapers that I studied.
We're going to take a quick break because we have so much to talk about over this next hour. If you want to be part of this conversation about media and epidemics and pandemics, go ahead, chime in, lend your thoughts to this conversation, ask questions. This is the night to do it. 615-737+ is the number. And we're going to start talking about media and COVID when we come back. Stay with us.